Hello, my name is Gladys Lucio and I'm going to discuss the hormonal implant. So what is a hormonal implant? A hormonal implant is also known as a contraceptive implant. The birth control implant is a thin, flexible plastic implant about the size of a cardboard matchstick. It is inserted under the skin of the upper arm. So what is Implanon? Well, Implanon is the brand for this type of implant. This medication is used to prevent pregnancy. The rod that is inserted slowly releases a hormone over a 3-year period. The rod must be then removed after the 3-year period and replaced if desired. The rod can be removed at any time by a trained healthcare professional. It does not contain any estrogen, rather it contains a form of progestin, which is a hormone that prevents pregnancy by preventing the release of an egg, and by changing the womb and cervical mucus to make it more difficult for an egg to meet sperm, or for the fertilized egg to attach to the wall of the womb. So if you decided on using Implanon, you will need your medical history and a physical exam. The procedure takes a couple of minutes and insertion is always faster than removal. Here are some of the steps in which the insertion procedure is done. First, the healthcare provider will sterilize the area, and 2, a small incision will be made, and 3, the rod will be inserted through a special needle that will release the rod underneath the skin. The removal procedure is a little bit more time consuming just because of the fact that the healthcare provider must locate the implant. If the implant is not able to be found by palpation, then a 2-dimensional X-ray is recommended. Then an ultrasound must be used to localize the implant and guide the removal. Some of the costs of Implanon varies. It varies due to insertion or removal. Insertion is 0 to 800 and removal is 0 to 300. Some of the advantages of Implanon is that the implant is safe, simple, and convenient, and it lasts up to 3 years. Also, you are able to become pregnant quickly when you stop using the implant. It can be used while breastfeeding, and also it can be used by women who are not able to take estrogen. Also, there's no medicine to be taken every single day. Some of the disadvantage of this implant are the side effects, and one of the most common side effects are irregular bleeding. But side effects are normal and most women adjust to them. For most women, periods become fewer and lighter. After 1 year, 1 out of 3 women who use the birth control implant will stop having periods completely. Some women have longer, heavier periods, and some women have increased spotting and light bleeding between periods. Some of the less common side effects are change in sex drive, discoloring or scarring of the skin over the implant, headache, an infection or pain in the arm, nausea, pain at the insertion site, sore breast. One out of 100 women can become pregnant, and there are recommendations for this method because there are medical interactions and the implant doesn't protect against sexual transmitted disease. Some of the certain medications that become less effective while on this implant are TB medicines, certain medicines that are taken by mouth for yeast infections, HIV medicines, anti-seizure medicines, and mental disorder medicines. Visit your healthcare provider for more information. You can also visit Planned Parenthood for more details. Thank you for watching.